to go to the management of Fortis Healthcare. Let's listen into what they have to say about their numbers.
My first question would be, you've seen a strong margin performance when it comes to Q1 FY26. What's your outlook for maintaining or further enhancing, these margins in the coming quarter, especially considering the new O&M agreement that you have signed? Because I remember you talked about, a 2% growth when it comes to EBITDA margin. So your view on that?
Yes, so our performance has continuously improved, and both the volumes as well as the realization have been good. As you pointed out, the RPOB as well as the occupancy saw growth. So these two factors have been main factors to improve our performance. But I think this performance has been consistent for last many quarters and in line with our commentary on this. So we expect this to continue. As far as the O&M of Clinical 700 beds, which we are going to be managing, is going to be accretive. That revenue we will not be taking, but there would be an O&M fee, which would be 3% of their top line. So that would be accretive to our bottom line.
Understood. So on the margin side, so the margins were at 22.6%. Now, any scope of further enhancing these margins when it comes to whole year FY26, or I would say, what is the margin outlook that you have for FY26?
Yes, so we have consistently said that every year we expect 2 to 3% of increase in our EBITDA margin till we reach a level of about 25% or so. So there is a further scope of improvement which we will get, because this year we are also adding about 900 capacity bed, which includes the newly acquired hospital in Jalandhar, which is about 283 beds. And these beds, at least 50% of them will be operationalized within this year. So that will also contribute significantly to both our top line as well as bottom line. But since some of these capacities are going to be new, so we expect that gradually over the next 1 or 2 years, we should reach the figure of 25%.
Understood. Dr. Raghuvanshi, when it comes to RPOB, it grew 10.2% and the occupancy also increased to 69%. Now, what specific initiatives or the patient mix shift contributed to most of the RPOB growth, number one? And what is the target occupancy when it comes to FY26? Because I remember you had a target of 70 to 71% of occupancy. So your outlook when it comes to occupancy and also RPOB?
Yes. So RPOB mainly grew because of the case mix change. And if you would look at the different segment of service lines in our hospitals, oncology has grown much faster than other specialties, though all specialties have grown. But oncology has become the the largest of the service offerings. And that has typically a higher RPOB, and that has led to a case mix change, which is favorable towards increasing the RPOB. So we don't expect the RPOB to increase in the same manner in future. It will get slightly moderated. However, the occupancy numbers we are targeting, as we had said earlier, above 70%. So hopefully we should achieve that within the next 2 quarters.
Sir, any reason for moderation of RPOB growth?
So, because right now we are seeing a case mix change, and we have not done any significant pricing interventions, and we believe that in healthcare, pricing changes is the lever which should be used as a last resort. So we are only basing our RPOB growth on the case mix change. So more complex cases, we are doing more robotic surgeries. We are doing more complex procedures in oncology and urology and bone marrow transplant, etc. So these cases typically have higher realization. So our strategy is to do more tertiary, quaternary kind of care, and that should result in a better ARPOB rather than the pricing. So that has always been our strategy, and we will maintain that. So that's why we believe that after a certain growth spur, you would see a little bit of moderation in the ARPOB, but that would get compensated by a increased occupancy.
Understood. Got that point. Also, sir, so on a consolidated level, I'll come to diagnostic in a bit, but on a consolidated level, what is the revenue growth you're targeting when it comes to FY26 and of course beyond that as well?
Yeah, so we expect mid-teens growth continuing through the year. We are expecting slightly higher growth on the diagnostic side, which is currently about 7-8%. We expect that to become better as our brand is getting more established. We, as you're aware, that we had changed the brand and that had impacted the business to some extent. But now that is behind us, and we are expecting that to grow much faster. So the diagnostic business we expect to grow about 12 to 14%, and the hospital business to grow about 15 to 16%.
Okay, that's great, because I was actually on to ask you about the diagnostic business also, but great that you have an answer for that. Sir, also operating beds as of FY25 stand at around 4,000 odd beds. What is the expected addition that you're going to make this year?
So we are going to add 900 beds this year, capacity beds, but we will operationalize only about 50% of this. 900 beds also includes 283 beds in Jalandhar in Punjab, which was a recent acquisition, which we have concluded just last month. And that hospital gives us a very good positioning in Punjab with about 1,000 beds over there. But out of these 900 beds, we expect at least 50 to 60% bed getting operationalized within this financial year.
All right, so that's the management of Fortis Health. And by the way, a good set of numbers. Stock is up 3.7% or thereabouts. Quite a substantial improvement in the operating profit as well. The margins have expanded in the quarter gone by. You heard why that is. Let's go back to the queries. And by the way, if you're tuning in just now, there are two ways in which you can ask your questions. One is the number on the top of the screen where you can send us your messages. And two, on the bottom of the screen, you see the number. That's my numbers. Okay, there. You can call us. All right, the next question is on Kalyan Jewelers, and Soumyadeep Chaudhary